Oh, okay. Now, you talked about whether Nigerians may not be able to have access to these medications. Were you referring to maybe some persons hijacking the process, or that Nigeria will not at all be capable of providing these drugs to Nigerians?
No, it's not anybody hijacking it. As a practitioner, I work in HIV clinic to a reasonable extent, and I understand that the services rendered there, from the counseling to the testing to periodic monitoring, if you extend that and see other patients in the facilities, they can't afford the treatment. Reason is not far-fetched. You see, many countries don't operate uh, out-of-pocket expenditure. Unfortunately, the middle, low-income countries, like mid-sub-Saharan Africa belongs largely, and Nigeria, have been utilizing out-of-pocket expenditure. Let me explain what out-of-pocket expenditure is. When people expend up to 40% of their income, on healthcare services or healthcare, medications, healthcare services, it impinges so deeply, on the monies you should have used on other things like school fees, rent, and so on. Now, or when you have spent so much money that you are unable to feed yourself very well, because you want to purchase out, it becomes catastrophic. It pushes people into serious burden, and that has been largely what we are practicing here. Health insurance would have been an easier way out, which have made people to go into the hospital. You pay in small aliquot over time. You pay a premium, maybe 1,000, 2,000 naira per month over the years. And if 200 million of us, let me say about 150 million of Nigerians, are able to pay that, 1,000 naira every month or 1,500 naira every month, you see that will be so much money in the pool that you can walk into the hospital. You might not be suffering from HIV. I am suffering from it. I can walk into the hospital and your own fund, will augment the fund that should have been, procured the medication. However, what we found is that Nigerians are not really believing, starting with corruption and so many things. Inefficient system we've been running, we are having some difficulties. And then sometimes the managers in the system do not really understand exactly what to do. I have to indict from the managers here, as well as some of them are my colleagues. But the issue is that the bottom line is that many do not, have health insurance coverage. And then that now makes it that if you walk into the hospital today, right from paying the card, the protecting the card services, buying card, paying for consultation, paying for laboratory services, paying for medication, pharmaceutical services, any services, you will have to spend the money. Now, health is such a business that nobody plans to be ill. The illness is such a sudden occurrence, and people are not prepared for that. So, we have actually given us the opportunity and we would have lived on that opportunity, to pay small, in to access help. That is what is done in so many developed nations. People don't go into the hospital to pay full bill. You may pay, let's say, for example, you had a surgery or you had a treatment that cost 100,000 naira. You might be expected to pay just 10% of it and then you go home. That would have been easier. For those of us who are practicing health insurance, like the civil servants at federal and state level, they may not have some difficulty. They may tell you their experiences with health insurance is relatively, better off than being catastrophic. So I am seeing that people may not have that fund. I take my time to explain this health insurance to everybody so that we can understand the meaning of access. People may not have that fund to access that health care. Not because somebody somewhere wants to, stay for the fund. No. Fund is never enough, and we needed to get efficient management of that fund. It's not forthcoming within our health system.
Thank you very much, Doctor, the Secretary of Public Affairs Analyst in Enugu State, and also a doctor in Enugu State. Thank you very much for joining us, Dr. OBASI, for joining us on the discussion this morning. We appreciate it. Thank you very much.